Welcome once again. My name is Dr. Guadamuz, and we're going to jump right into it here, into the fundamentals. What is public health? This whole section, this whole part two, we're going to be dealing with the paradigms of inquiry and definition. We're going to be breaking down some basic concepts and some basic terminology. And the reason we're going to be doing this is because although we have some proposed definitions and clear ideas, we may want to revisit them because they're pivotal. They're very vital in our efforts to achieving these grand scale and broad reaching efforts. So what we have before us is the definition that the CDC provides for what public health is: the science and art of preventing disease, prolonging life, and promoting health through organized efforts. Now, that's a very clean, strong, and encouraging definition. However, I'd invite you to think about, do we know who the public is? Now, why this is an imperative question to ask is because given that we are organizing our efforts to provide health and prolong life to the public, we ought to define who the public is. So let's take a step back and let's see how this fundamental breakdown of this concept is actually quite pivotal. It's very important in continuing the conversation of creating policy and mandates if we're going to be diving right into trying to reform an entire healthcare system. So let's start thinking about who is the public that we're talking about. Now, we can take this from two different dimensions or categories. We can take this from a personal, introspective, or a reflective kind of aspect, asking ourselves who the public would be to us that we're trying to promote health and longevity to. Now, typically, most doctors, I would think that, or anyone in the healthcare profession, and I would think that humanity itself is inclined to want to help and promote life and health for everyone. So, in an altruistic kind of sense, we want to care for humanity itself in an international scale. However, at the systems level, meaning the system, right? And in specific, the US healthcare system, we have to have very specific terminology with very specific conditions and defined terms for that terminology. So the public within that context may have to be specific. Now, are we talking about everyone within the U.S. boundaries on the geographical platform or the land mass that is what we consider the U.S. Boundaries? Or are we talking about only tax-paying citizenry? Or are we including residents? Are we including immigrants? And are we including legal and illegal immigrants? Or are we just including legal immigrants? Now, this question is fairly simple because really what we're talking about is very likely through the system's eyes, tax-paying citizenry. However, there are externalities. And what I mean by externalities is that, for example, we have many great hospitals and healthcare providers throughout the US. And many of them, most of them, are very accessible and accommodating. Now, given these two very important facts, I don't know of any doctor or hospital that, should a patient needing care be presented before them, would deny medical care, despite them being an illegal or legal immigrant. Whether or not within the system they are included in what is called the public. Therefore, they are an externality of the system, meaning that they will be given care even though they are not accounted for in the system. So it's a complex idea to think about. Allow yourself to maybe pause the video and sit through it. But we should consider the consequences of either side of expanding and opening our boundaries to what the public means, or constricting it and restricting it to a certain population. There are pros and cons to both, and there are very specific reasons why we've set it up in the ways we've set it up. So these are things that we have to take into account and have a cohesive connection to as we proceed in the evolvement and the development of our ideas and of our design for what healthcare should look like and what changes need to happen, or what externalities we should take, I guess, account for, or and how actually. So we're going to lay that one aside. We're going to say that we're assuming that there is an agreed upon premise, that we're all agreeing that the public means one thing. We're all agreeing that the public means tax-paying citizenry. We may even include legal immigrants and residents, and allow that the illegal immigrants are an externality of the system that place a burden on it, but they will be taken care of. However, that is the limit to the degree of which who we define as the public. So outside of the US boundaries, that's not who we're talking about. We may have a personal mission to extend care beyond those boundaries, but the public, so far as the system is concerned, is concerned with that boundary. So we're going on that premise, and we're going to move forward. Although you can see how maybe even that, defining that concept in and of itself, can be a very troublesome act if you're considering certain circumstances. So we'll move on from that. And we have to ask the next question. In our organized efforts to prolong life for the public, mind you, and promote health and prevent disease, do we know what each of these mean and how to accomplish that? Meaning, what is health? Now, to prolong life, obviously you need to promote the health, but to prolong life, you also need other things that can probably kill you along the way that are not specifically tied to medical care in terms of health. And disease, are we doing well at that? Meaning, do we know how to do it? And if we aren't, then is our concept of health well structured? Meaning, do we know what health really is in the context of the human body enough, so much so that we can prevent disease because we know how to establish health in the system? And if we do know what health is, and we're very well aware of it, and we can prevent disease, why isn't it happening, or what's inhibiting it from happening? But first, let's touch on what is health, because it touches on all three of these aspects which this science and art is supposed to be working on as an organized effort. So let's move on to the second fundamental question of what is health. And actually, I skipped a slide there, but before we do so, I want to go into the inquiry logic. So the purpose of this slide is to show you kind of the sequence of the questions that we're going to be navigating. So we went through what is public health at a very fundamental level, and we're going to be defining health and defining some of these other measurement tools that we have to measure the quality of the systems. But we should, along the way, always be considering what our goal is in the sector of public health and why our goal is what it is. So throughout the whole process, let's keep this question in mind. Now, we can always come back to this inquiry logic kind of diagram that I have before you, but just take a snapshot of it if you'd like, and we'll continue with our presentation. Now, I will make a note that this is a very vital part of the presentation, because it's how we've strategized the development of our conversation. This is the strategy of how we're going to get from point A to point B, meaning how we're going to improve public health by first knowing what public health is, what our goal is, how we measure whether we're successful at our goal, and what things we can do to make those changes. So now we get into the health concepts and the defining the concept of health itself. And what we find is other very strong and powerful definitions. The very first one up here that we see is provided by the World Health Organization. And this is actually quite an old definition. This is not new. And yet, I would say that we can easily say that, or we can probably easily agree that this is not quite how medicine is practiced, or rather, this is not what we see this medical decision making is informed based on. Now we can see transitions, we see momentum, but it's been the same for quite a while. And even though we have this perhaps evolved notion of what health is, we haven't quite found a good way of applying it in practice. So in the clinic, we haven't really implemented it in a way where it shows that this is how we define health for our patients, and that we're all in congruence about how we're going to be utilizing the concept. So the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. It's quite a mouthful. That's saying that health is not simply a vital sign, like your blood pressure reading or your heart rate, but rather that it's, yes, your vital sign, but it's also a subjective sense of how you feel, what your social environment, your mental health. And then as we move on along on more recent introductions of definitions of health, ecological determinants. So we see that the purpose of this slide is to show you that we're actually not in complete agreement as to what health means. And so we have to keep in mind as we implement these policies that we're still catching up to the definition of health and actually defining health for ourselves. And even though people like to say on various different subjects the science is settled, it's actually quite far from being settled, even at this very fundamental level. We have different ideas about what health means. If we look at the Harvard study from 2014, and this study was in regard, by the way, all the references are at the end of the presentation, and of course you can always contact us to have the citations, but anyways, the study was in regards to dynamical complexity, which is it's a field of study that it comes from another discipline. It comes from engineering and programming and computer science, and this was something that was designed to make sense of how, for example, the weather is impacted by different phenomena, right? So there are so many variables that you have to take into account that you can't only say just one thing is going to impact the weather. We know that maybe it's pollution, it's also the solar system or earth changes, it's also seasonal and climatic changes and just natural geological changes that are happening. It's also man-made effects. So it's very complex. So meaning, if we're talking about the system, the ecological system of the climate, this is the example of a complex adaptive system. It is determined by multiple factors, not just by one, and not only by multiple factors, but by all of the factors interacting together in a dynamic way. So it's a very complex idea of weather and climate emerging from all of these factors coming in and interacting with each other, and then sustaining this kind of atmospheric state of environment, right? So we can apply this to health as well, and this is where we're going to end.